and YouTube family. This is Candace Richardson Dickens, dope black therapist, owner of CRA Counseling Consulting Agency. And I am here with the magnificent midwife, Miss Monifa Dukes. How are you, Miss Dukes?
I'm doing fine, and you? Thank you so very much.
Let me tell you something. The last time you were on here, we got so much love, so I had to bring you back. Girl, you're my guest ever. So I want you to
Thank you.
knowledge, help other people who are in peri-menopause, menopause, post-menopause. Give us some information that's going to help us. Please, I need some help. Uh,
Yes.
wait,
So menopause. Go ahead. Go ahead. You got to
what,
go.
what is menopause and what causes it?
Okay. So menopause, a lot of people don't know. A young lady, a woman has to go a whole year without having her cycle. Sometimes we get real close to it. We be at that 11 month and then our cycle come and nope, that's not considered menopause. You have to go a whole 12 months of not having a cycle. And generally what happens is our estrogen level goes down, our progesterone level goes down, and that's when we start experiencing the physiological symptoms.
It's funny. I heard Ilana Van Zandt said when you go through that change, you get 3 hairs on your chin. And I was like, what you talking about? And then one day, girl, I have 4 hairs. And I was like, oh my God, I must be a menopause. I'm becoming a man.
Not by the hair, my chinny chin chin. Yes, that's true.
Is that was causing the facial hair? Because for a lot of I remember being a little girl and seeing an aunt who had a hair, like one hair here and one hair here. And I was like, why is she all masculine like that? And then when I had my own, I was like, oh my God, everyone sees it. So, what are the physical symptoms? Because those are the ones that a lot of us know really well. What are some of the physical symptoms that your body age group that it starts? What's the age group and what are the physical symptoms?
So, so they say the average age is 50, 51, but to tell you the truth, you really start experiencing these symptoms about 5 years prior.
Like,
So I have women who come in at 43 years old, 45 years old, saying they're having hot flashes, which we all know about the hot flashes, the night sweats, feeling more irritable, unable to sleep. And you have the dryness, the vaginal dryness, as well as the texture of our skin kind of get a little more thin but rough.
so we see all those commercials with actresses with the skin stuff and the aging and the puppy eye stuff because it's the dryness us more.
Yes. So as the estrogen starts to leave our body slowly but surely, that's when we start to experience these symptoms.
Oh wow. Vaginal dryness. So that's what
Yeah.
caused wow.
Yes.
Body change that happens with us. And is that caused by the nits or is that just the hormone imbalance that just happens?
So you're coming in and out. I'm thinking you're saying that uh,
That
the
dryness, the night sweats, and the insomnia. Does it happen gradually or for most people?
no, so it happens. Everyone affects differently. Some people it just hits them overnight. Some people it's a gradual effect. Some people experience the symptoms worse than others. I hear some people saying they just want to come out their skin with their hot flashes. Some people just they could just fan themselves and be okay. So it affects people in different ways. I have patients who is interfering with their marriage because now they're dealing with the vaginal dryness, and so it's more painful to have sexual intercourse. So and then we also have where we're more irritable. Our anxiety goes up. Our depression goes up.
That anxiety and the because I was ready for the night sweats because I've seen women come in layers where they wear jacket comes off, the sweater comes off, there's a tank top, and like, oh my God. or they'll be speaking and it's like they're on fire,
Right.
right? And I was, I was so excited that I don't have those symptoms where I'm not.
Right.
But that thing about that anxiety, woo, I didn't
Yes.
until I was speaking to other women. They were like, "Well, I'm getting real anxious," and
Yes.
oh,
Yes. It just this morning, today, I had a patient and she says, I need help. She says, my anxiety is, to the roof with this, is it, and the thing is with us females, we blame ourselves for a lot of things. Um, and we got to realize, I tell my patients, we full of hormones. And as our hormones change, it affects us in different ways. So as that once again, that estrogen is a very powerful hormone. Once that one starts to decrease, it affects us. When you're not getting enough sleep, you're more irritable, you get more anxious because you're not sleeping well.
mm, absolutely.
Yes.
Because when I watched Real Housewives of Atlanta, I'm like, well, they must all be in menopause because everybody wants to fight. Wants to- Everybody must be having one big menopause moment. I, I don't know women in their 40s or 50s who want to fight, but that's something like faster. You get frustrated. At least when I clients, they're agitated, but that anxiety is something that people don't talk about.
No.
The concentration is off. Like I've heard people, and they'll read the Oprah magazine, stop club because they concentrate.
Unable to concentrate, feel foggy. Your head feels real foggy
So,
and difficulty concentrating and thinking. Yes, you're so correct.
and that's all menopause. The problems with concentrating, the fogginess, the having to read things over and over, the forgetting where your keys are at. If anyone's out there, you know, please raise your hand, put in a comment because we don't learn those symptoms. We think, okay, maybe I'm just overwhelmed or I'm just really, really busy. But people don't, those are signs of menopause.
Yes.
Yeah,
Yes. Yes. And we like I said, we are so hard on ourselves with it. And I hear you say anxiety, but then I also see a lot of women going to depression at this time
real.
because why this is happening to me, why I can't get my thoughts together. I used to be on Johnny on the spot, and I'm no longer Johnny on the spot.
Yeah,
And depression. And then let's think of the age range of when people are going through perimenopause and menopause. Some people, this is when the age where their children are going to college, or they get starting to have the empty nest syndrome, and then so it brings on other feelings along with you changing hormonally.
got it. So the lifestyle changes also coincide with the body, the hormonal changes as well.
Yes.
Oh, that's it. So, what is the difference between perimenopause, menopause, and postmenopause? And are the symptoms different in when you're in each stage? Are the symptoms different when you're in menopause as opposed to perimenopause or postmenopause?
So perimenopause is when you start, and so remember, menopause is you going that whole year without having a cycle.
Okay.
Perimenopause is you may be skipping a couple of months. You may go 3 months without a cycle, and then you have the cycle or stuff like that. But during each of those stages, you will still experience those symptoms of the hot flashes, of the night sweats, of unable to concentrate. Does it get better as you get older? Um, with some people it do. With some people, I have them on hormonal therapy and in their 70s and 80s because they try to take themselves off the hormonal therapy, but they start experiencing the symptoms again.
Did you say 70s and 80s? Did you? Oh my God. This is like, oh my God. I'm gonna be back
Yes,
in the bed because one of the things I said to my friends, it's like PMS that never ends.
yes,
Yes. Because I can remember
yes.
PMS and being irritable, and the week before not being able to concentrate, couldn't do my billing. And I'm pretty organized, but when this is on, it's like it's taking me a while to do my taxes, and I like doing my taxes.
Yes.
It's just like it's different. It's
Yeah.
so for the people who have, I know, and I read in Oprah did a whole issue on this, where she talked about there's pain with it, like you have all these aches and pains all of a sudden. Can you talk about that?
Yes. Well, and once again, that big old E, that estrogen, once that estrogen starts to come, it's with our bones. Your
Yes,
bones start to hurt more. And the hips, the knees, the back.
can't go clubbing no more.
What's that song? My neck, my knees. That's why we know we see our parents and elders doing the 1-2 step. Now I know why.
I'm rocking that one too. One, two, what? Down. My knees hurt. But it's funny because I can remember saying I had a shoulder surgery, and I remember the doctor saying, "Wow, you don't look your age." And I was like, "Really?" He said, "Yeah." He said, "But your bones are your age, and the aches and pains are your age." He said, "You look
Yeah.
younger, but your bones and everything else are going to catch up to you, and you're going to feel your age." That expression on crack, but we hurt like all women in our age group. So
Yes.
why do you think that we don't talk about that? Because it impacts even many of us at work. And at work, there's more sympathy for people who are pregnant, people who have severe PMS or some other disorders. Why is this one not talked about as a work health condition that can affect performance? Why is it?
And, and that's an excellent question because I even said, growing up, we had books about the puberty, the different stages we'll go through. When we're pregnant, we had the book on what to expect when you're expecting. But it seemed like there's a taboo about talking about menopause. And
Mhm.
I feel that that's why so many women feel like they're going mentally, they're having the mental issues or the anxiety, depression because they feel like they're going through it by themselves.
Oh,
And they don't, it's not talked about much.
got it. So you think this is part of the age a sexism experience where we're not talking about what happens when women get older
Right.
and how the body changes? Because you're right. I remember my mom giving me the body and you and thinking, oh, look at this, look at the sex and the do-do-do-do-do-do-do-do. But then and then the pregnancy week by week, right?
Yes.
Changing. But there's no week by week for this.
No, it sure ain't.
And it's so easy because I can remember being in my 40s and I remember in one week I wanted to fight three people. Literally, I was gonna fight three people. And I was like, that's just not me. I don't want to snatch people up. And now that I'm looking back, I'm like, oh, because I wasn't having the traditional symptoms, I'm thinking I'm just stressed, I'm overwhelmed, I'm doing all this stuff in my business. And it never occurred to me, something's shifting on you.
Yes.
Yeah.
And I mean, if you want to get more medical, it's like the serotonin in our bodies that's, starting to decrease. And so then that's why they started putting women on Paxil, SSRI. That's
Ah,
what they started putting us on during menopause because we was having the anxiety, the depression, the OCD behavior with menopause.
part again. That OCD part. Say that part again. I'm sorry. I didn't hear you. Get out of my house. Stay out of my house. Because girl, I'm cleaning and organizing. Woo! It's, they
Yes,
can't even move anything in my house. Like, don't move that. I need to have it organized so I can function.
right.
But we laugh, but one of the things that happens is, I know when I spoke about it to some other women, they were like, you know what? Their providers aren't medicating or talking about it. They're like, well, that's not really a symptom. The insomnia is a symptom. But they don't talk. You're the first one I'm hearing that the OCD, which is a part of the anxiety disorder, kicks in.
Yes. And it can have a snowball effect. So, you say someone is used to having they living room clean,
Mm-hmm.
and they come in and it's out of place. It's not how it's supposed to be.
Mm-hmm.
It brings up their anxiety. Oh my God. And then what? It brings on that depression. The time, I can't get nothing accomplished, da 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 da. So, sometimes with women, it does have a snowball effect. And then they bring it to bed with them, unable to sleep because their mind is constantly racing and planning throughout the night what they need to do. And then you got your night sweats going on. And then you got someone tapping you on your shoulder at nighttime talking about can I no.
Mm. And what libido? So if there's dryness down there, I remember seeing Tabitha Brown saying, Catherine, who lives down below, Catherine changing with icicles on it, and she's like, I don't know, Catherine's doing that, and she was mad at her husband because he had not told her that Catherine had changed. She said, I Catherine, but he looks her eye to eye.
Yeah.
And it's interesting because that's something that we don't talk about.
Right.
Really interesting that we don't talk about it, and it goes back, but it's part of the aging process.
It
So
is.
yeah, so for many of us, we hear about menopause, but we don't hear about post-menopause. Like, what does that look like? If this is this part, and it's 1 year with no menstrual cycle, then what does post-menopause look like?
So postmenopausal, I mean, we still have those symptoms going on. We may adapt to them a little bit long more and stuff, but one thing I do want to tell all the ladies out there, if you postmenopausal, which means you have went a whole year without having a cycle, you should never, ever, ever bleed again. Spot or anything. And if you do need to go see your doctor immediately.
Immediately?
Yes, ma'am.
That's a big red flag.
Yes, ma'am. It's a red flag.
Okay, thank you. Are there any other red flags that we need to look at in our body that we've got to be aware of? Because we're talking about a lot of symptoms that people don't normally speak about because of the shame. Because
Yes.
for us, the culture is about you. And so for many of us, we color our pretty hair. Let me hit the last week, girl. Let me hit the last week. We color a little makeup. And then we say, I'm 30 over 30. But we don't quite say what we're at over 30. You are at. you know, but so it's really helpful to know what are some signs that you need to be aware that something is wrong. Like you said, so if there's bleeding after a year, that's a concern. Any other concerns that we need to look at?
Well, that is mainly it. I know another thing, some women, and I don't know if you want me to touch on this much, some women are with treatment for the symptoms. I always try to go the most natural route. I start with let's go more natural, and then if you want to go to therapy, hormonal therapy, then we could. But if you are on hormonal therapy, make sure that you're having your annual exams for cancer screenings.
Got it. What are some natural things that women can take? What are some natural things that you recommend?
So, of course, increasing your vitamin E is good. Evening primrose oil capsules, excellent. That
Ex-
helps that helps with hot flashes. I even have my young ladies who if you have we just call it fibrocystic breasts or dense tissue when your breasts get a little tender before your cycle come on. But it's for your hormones and it helps to regulate them. Some people do black cohosh.
I
Um
do that.
yeah.
Makes it different. My husband's still alive because of that. I'm just wait. Whoever makes that black cohort, thank you. That man should be sending you a text, an email, a present, whatever. Take two of them every day. And my sobriety says, my line says this. Shout out to the Deja Vu line. Every morning And I asked them, I said, hey, I'm getting irritated and I'm anxious. And they were the ones saying, hey, take this.
Hmm.
Right?
Hmm.
But I didn't know. Knew nothing about it. I thought I
Yeah.
estrogen, which is extremely expensive, and some other things. But even the vitamin you mentioned, I didn't know anything about that. So I might get that too.
Yes, it's good. It's good. It's more natural. If you want to go the natural route.
Yeah,
Yeah.
that's awesome. That is awesome.
Yeah.
And for people who are having extreme symptoms, right? Because I know that people who are in the 30s, 40s, 50s, we're in leadership positions and we're noticing there's a change in us. And sometimes we can't put our finger on it, but once we do it, what are some things to be mindful of? If we're having difficulty, because if you're frustrated and you're not sleeping, you might show up a certain way with the people you're managing. You might be real tight, micromanaging a little bit, or just feel over
Right.
task that you normally could do. What are some tips you would give them? Some takeaways, some tips, some suggestions.
It's
But
I'm gonna be honest with you. It's hard for that to give them because they sometimes they don't see it.
yeah,
Um, and so I would tell them, you have to listen to others. And like if I do start them on some medication, I'll say you may not see the difference, the others will, and they will let you know. Wow, she's more nice now, and stuff. So yeah. So sometimes sit back. You got to sit back and assess yourself. Have a
yeah,
react. Have a one-on-one with yourself.
that's awesome. And it goes back to knowing yourself and knowing that you're different, and also letting people give you feedback about.
Yeah.
And I know I had a conversation with my mom that we've never had. We've never talked about this part. Because
Hmm.
a little girl, knowing that people in my family as women, they menopause early. So I'm thinking, let me get these babies out the way. If I had known that it wouldn't be into my 50s, I would have girl. I love my baby. Let me stop right. Late, sudden, early, into late.
And so, but I'm glad you brought that up because that's one of the things I tell my patients also when they come and say they think they're going through menopause. I'm going, and I says, well, do you have an older sister? When did she go through menopause? Because you generally kind of follow those, your siblings, or to ask them to ask their mothers. But so many mothers has had hysterectomies because that was the thing to do at a certain time. So it's hard to get that history
Right,
from there.
right. So that's great because it's really asking because this is when the history matters.
Yes,
When the
yes,
matters, right? Because it
yes,
figure out what's happening with you, and then since there have to be parts of it, it also helps you figure out what's going to happen in that post part as well. Like how
yeah.
she's doing will be how you're doing, and for people whose mothers aren't alive, it'd be great to look at the history. We all have a medical genealogy. Um, but
Hmm.
somebody knows your information, or your auntie's information, or your mom. Someone knows.
Hmm.
Yeah,
Right, right.
that is so. One of the things, but they still do we still go to the GYN as often once you're in menopause? Do you go once a year? Or you once?
Yes. So a lady's supposed to go to GYN every year, depending on your insurance now. All right, because Medicare changed it every other year.
Got it.
But yes, but you should go every year to get your well woman's check done. Get those breasts. You want to get your breast examination because you want to look for that breast cancer. Even if you had a hysterectomy, you still want them to go inside and look at the texture of your vaginal walls, look at your mucosa, and the everything of your vaginal area and your health. Now,
Awesome.
do you get a pap smear every year? That's different. There's different guidelines. But once you turn 65 years old, it's recommended that you do not need a pap smear anymore if all your other pap smears have been normal.
To look forward to. I'm just saying. There's a silver lining in this somewhere, and you just hit it. And one of the things I'm going to say to people who are watching is that if you're different at work and you're different at home, you're different socially, connect with a clinician. I know that I am, now that I'm aware what the symptoms are, I am speaking to all my clients. I'm like, hey, if you need intermittent leave, if you need to have some time off, because I'm treating this like a medical condition. And I think that there's such stigma about it that we don't talk about the emotional parts, how it impacts the cognitive part. Because sometimes the medical provider may not be willing to give you that leave, but if your clinician hears that, wow, you're struggling, and they've known you for a while, go, wow, you really are different. Like I've had clients who say, I've never had panic attacks, or I'm a project manager and I'm struggling. We can recognize that and give you some support, and maybe even bring in HR and make sure that maybe they can modify the environment for you, because it's like every other disability
Right.
condition, you have to have a equal playing ground. And if we can advocate for you, then we can give you that. So we
That is
take,
wonderful.
yeah, it takes the shame out of it, and it makes just like menopause. It makes it so that people can create an environment that compliments you, that doesn't want
Right.
to penalize you, because the fear is for many people in their 40s and 50s, I don't want to do something that's going to make me stand out in the worst way. I still want to be marketable,
Right.
right? There's
Okay.
a women in age, and there's a standard for men. And one of the things that's great is if you have a midwife or an OBGYN or nurse practitioner and you have a good relationship, then make it,
Yeah.
how do we do the health? How do we do the work part so that you're not in jeopardy of losing the job if you're struggling, or even couples counseling. Talk about, well, you're in a different phase, because I know a lot of people who are like, kids are going, deuces, I'm out. And we're like, slow down. Changing. So you want everything to change. Make
Yes.
it workable.
Yeah. You know what? I really love that concept you just put out there. Thank you. I love that.
You're welcome.
Yes.
You know, because it is something that people have to make accommodations for, even family members, because you may be the most responsible person, and for a lot of women, they're the organizers, they're the people that keep the glue together. But what happens when they come apart and they can't remember
That's
things?
true.
They're,
That's true.
right? There's that feeling of shame or that feeling of guilt,
Yes.
right?
Yes.
And we want to take that away. And by you coming on, we really educated people about, wow, recognizing that just like everything else, this is something that impairs you. It's a hormonal issue that impacts the brain
Right.
and how you're thinking and processing, and impacts the body. So this
That's
is
true.
awesome. So before you leave, any other suggestions, any other tips, advice that you would give to people so that they can live strong and healthy?
I'm just going to run through everything real quick.
Yes.
All right. So remember, menopause is a whole year of not having a cycle, a whole complete 12 months of not having a cycle. Perimenopause could start up to 5 years prior to that. So you may start having those hot flashes. Want to take that wig off and just fan yourself, night sweats, feelings, the anxiety and depression. Yes, that not only have physical changes, but we all have cognitive and mental changes. Foggy brains, unable to concentrate. Yes, that's all normal.
And the aches.
Postmen, yes. Postmenopausal, so you went the whole year. You still may feel those hot flashes and have those symptoms,
Mhm.
but also stay on top of your health. See your GYN, midwife, nurse practitioner every year. Every year, whether you have a hysterectomy or not, still see them. Get your bone density test done. That's another thing a lot of people do not know. As our estrogen goes down, we lose the density of our bones. So you ask your doctors after, when
That
should you get your bone density test?
that way you start shrinking or get that hunchback. Is that?
Mm-hmm. Yes, ma'am. And well, it lets you know what is the percentage of you fracturing a bone
Oh
and
wow.
stuff. Yes, so that's the reason for the bone density test too. Yes.
Wow, thank you. And as a woman of color, should there be anything that because I know that women of color at high risk for heart disease and coronary issues, and I think are we the biggest group for strokes or cardio?
Strokes also too.
Yeah, and cervical cancer. Are we the two highest groups? Are we the highest group for that, or just the stroke?
Oh, strokes, diabetes, Of course, hypertension
Okay.
and weed cancer.
Wow.
So, even though if you ever get on a hormonal placement, I know so many women are afraid to get on hormonal replacements because of breast cancer. But if you get those screenings,
Yeah.
it's safe and stuff. And also, it has shown that it helps with the density of your bones by being on that estrogen too.
Thank you. You are preaching to a choir because I didn't know any of this. So this is all. So as you're learning, people, I'm learning. So I'm like, wow, I didn't know it. All I knew was you got to get a colon test. Once you get 50, you got to get the have the uncomfortable GYN event with my GYN, who's my vagina friend, who's not a friend when she does those other tests. And not my friend. But I never heard of the other stuff. I know about the shingle shot. So you're really giving some information that for a lot of women we don't know. And I just want to before I let you go, can you speak
Yeah.
to something about changing our diets? Right? Because I love the fact you talked about trying some herbal things. What about diet and exercise? How important is that? Because I know I read something about that in Oprah about the importance of changing diet and exercising.
Yeah, so exercising increases our endorphins in our bodies and stuff, which helps keep that cancer away from us also too. So you want to, and I'm not telling you to go run a marathon. I tell my patients if you walk 15 minutes from your house, guess what? It's going to take you 15 minutes to come back. That's a
Mm-hmm.
mile you have done. Something very simple as that. And we have to be in that, especially the African American culture. We are so high risk for so many things genetically and stuff. We have to do a little extra, like in everything, to make sure that we stay healthy and be on this earth longer.
Amen. That's why
Yeah.
I'm to college. I have their dog. And I've met so many women who have their kids' dogs. My neighbor has a Chihuahua from New York, and I was like, you know what, you're still in New York. But what she said was that that my little emotional support animal is out the house. I have that. It, it allows me to calm myself down and address her. Down.
Yeah.
First, you natural medicines, some movements, uh, and even changing your diet. Eat healthy, more greens, do all that great stuff because we've been around for a long time.
Yeah.
They you just blew us away today, as usual. You might be a third guest. Yes.
Well, thank you for having me. I love doing this. I love teaching the women about themselves. And whenever Candace, if someone reach out to you and they have more questions, don't hesitate. They can reach out to me. I will. If I don't know the answer, I will find the answer out for you.
You have a website, or you need to practice. You're just so good. You just the website. That you need to have a website so that we can call you, send you text messages, and all that great stuff. So
Okay.
I'll work on you with that. But thank
Please
you
do.
so as
Okay.
for coming on. Everyone, thank you for being part of this amazing conversation. And Women's History Month is this month, and we're ending it on
Yeah.
a bang. Amazing speaker. Thank you, Monifa.
You're welcome.
Good
God
night.
bless everybody. All right. Bye bye.